afternoon. My name's Derek. I am your nurse. Can I get your name and date of birth, please? Okay. Miss Jane Smith, how old are you, Miss Jane Smith? All right. Sounds good. You must be our daughter that found her. How are you doing today? All right, excellent. Okay, so what I'm going to do today is I'm just going to give an assessment, check your mom out, see how she's doing. Ma'am, are you doing all right? Do you have any pain right now? If you do, on a scale of 0 to 10, what would you say it's at? 0 being not bad at all, 10 being the worst pain you've ever felt. Okay. Do you have any allergies? You do, okay. I see you're allergic to sulfa. Okay, not a problem. Can you tell me where you are? Okay. Tell me how old you are? Okay, good deal. So, we got a little bit of meds for you. We got to do an assessment. Do you have any questions before we start? No? Okay. Do you have any questions before we start? No? All right, sounds good. I'm just going to load it up. Yeah, I thought you were supposed to be hooked up to some fluids. I don't see that you are hooked up to anything. So, we are going to fix that. Get you hooked up. And I see that the line in your AC is infiltrated. That's all right. We'll figure out something else. We can run the line through there. Let me, at this point, I would raise the bed. There we go. Before we start, I'm just going to start checking all your lines that you've got. Make sure there's no kinks in them. Make sure that they're patent. Central one looks good. I don't see any redness. Everything looks like it's intact. So that being infiltrated, what we'll probably do is we'll just run your fluid through one of these lines. If that starts being a problem, what I'll do is I'll just start a second line on your left AC. All right. We're going to start by getting a little bit of vital signs. So the first thing I'm going to do is I'm going to check heart rate. Here. Just breathe normally. assessed her heart rate. I would move on to respiratory rate. Just breathe normally. I'm just going to check your breath sounds. Just breathe normally. All right, after I've done the front, I would have her sit up so I can hit the back in all 12 places. I'm going to move on and take her blood pressure. There's no cuffs. While I'm doing this, I would also be watching the rise and fall of the chest to get respiration rate. Okay, now that I've gotten the blood pressure, I'm going to keep listening to the radial pulse to get a pulse rate. We already talked about your pain level. All right. So first thing we're going to do is we're going to talk a little bit about the stroke that you had. I see you've got a little bit of left side weakness. We're going to do a quick assessment just to account for that and see if it's getting worse, if it's getting better, so we can track it. I saw that you were not a candidate for TPA, so we're just going to keep on doing the fluids and monitoring. All right. So, I know they already told me before, but what day is it? Okay. Do you know where you are? Okay. Do you know where you were brought here? Okay. Who's that sitting over there? All right, good. Now, keep your eyes looking forward, and I want you to tell me how many fingers I'm holding up. Okay? I'll just follow my finger. All right, good. Now, what I want you to do is I want you to take this right leg. I want you to hold it up, okay, for 10 seconds. Just do the best you can. If it falls down, it falls down. It's not a big deal. And just, let's see how you do. Okay, let's try the other side. see how we do here. Okay. Now we're going to do the same thing that we've done with your feet, with your arms. So let's start with your right arm. Just try to hold it up as best you can. Okay. We're going to try to get the other arm here. If you can, bring your arms toward you. Don't let me pull them down. Okay. You try squeezing my fingers. Okay. All right. You did good. You did good. It looks like you have a catheter in. I'm going to take a look at that, make sure everything's still connected, there's no infections. Is that okay? Do you want your daughter to step out? She can stay? Okay. Looks like it's still attached. Okay. Alright, we got a little bit of unusual coloring in there. We'll talk to the doctor about that. While we're here, I'm also going to do a skin assessment to make sure you're not getting any pressure sores or anything. Does that hurt when you lift your arm up? Okay. Any pain in the calves? Any swelling? No? Alright. That's good. That's good news. Anything on this one? Okay. Now I'm just going to roll you over on your side. I'll be very gentle. Try to do this quiet. Doesn't look like you have any skin right down there, so that's good news. Go ahead and relax. Alright, so the doctor says that you're going to get an NG tube for feeding. I know you haven't had anything to eat or drink. A lot of that is just precautionary. And so unfortunately I don't really have good news. You're not getting a lot to eat or drink, but I'm going to start a bag of fluid for you. And then I'm going to have the LPN come in, and she's going to do a NG tube so we can start getting you food into your stomach that won't make you vomit or choke or aspirate. So we're going to get you calories. You're going to feel full, but it's not going to be the best way to do it. But until we can get everything so that you can eat and drink on a safe level, we're not going to do it. Because I heard or I read that you failed your swallow study. Don't worry, not a big deal. Everybody starts out that way. You're going to get better. You're going to pass it. You're going to be able to work towards eating the foods that you had before. It just may take a little while. So it's all rough in the beginning, but it'll get better step by step every day. All right, and your daughter's here to help you, which is good, and I'm sure you have a lot of other people that are worried about you as well. Okay, so a little while we'll get the nurse to come in here, or the LPN to come in here and do your tube. Then they're going to have this big fancy x-ray machine come in, and we're going to make sure it's placed in your stomach so it's not coming out your ears or your nose or anything crazy, and that should take care of some of the hunger that you have. Okay. All right. Right now I'm going to start setting up your fluids. If you guys have any questions, please let me know. What I'm doing is I've got the fluid that the doctor ordered, and I'm going to run it through this line right here into the machine, and we're going to use the machine to make sure that you are getting a safe dose. Scrub this fork real good to make sure there's no infection getting in there. And do it for about 30 seconds. You can actually do some potassium because potassium's really low. So I'm going to turn that to So the first one I'm going to program, let me grab this camera here so you can watch me program this. Pump A. 125 milliliters an hour. And we're going to put 975 so it doesn't run dry. So both of those are infusing. Okay, so you're supposed to get furosemide. But I believe furosemide might be a problem, and you're supposed to get April for your high blood pressure, but they don't want you to have anything by mouth, but this is by mouth, so what I'm going to do is I'm going to call and see if there's a different way that we can get everything. Okay, so I'm just going to lower you back down. And the LPN's going to be in a little bit. I've got your call light here for you. Your bed's locked. It's not moving anywhere. It's good. Your fluids are running. We're going to get that medicine figured out. Is there anything else you need before I go? Okay. All right. Thank you guys very much. Okay, so I'm doing S-bar with Mrs. Jane Smith, who came in 24 hours ago for a ischemic stroke. She was found by her daughter. She had left-sided weakness and was having difficulty speaking. Since she's come in here, she's been NPO the whole time. She's been getting furosemide, 40 milligrams IV. She's been getting benzapril, 10 milligrams by mouth daily, which I don't really know how that is because she's supposed to be NPO. She was getting D5W normal saline with 20 milliequivalents potassium at 125 ml an hour. And that's what I just started. I held the furosemide because with that diuretic, it's gonna pull out more potassium, and her potassium is already a 3.3. So I'm going to contact the doctor and see if that's okay to hold. He also had a benzapril 10 milligram by mouth, but you know, he also wants everything to be NPO. We're about to start a NG tube, so we got to figure a different route to get it. I did a neurovascular assessment on it. She is a full code. She has a history of diabetes, chronic heart failure, AFib. She's had a 30-pound weight loss in the last 2 months. So you're almost looking at a failure to thrive. Her vital signs, blood pressure 150/90, pulse rate 88, respirations 20, temperature 99.8, room air 95%. She's not on nasal cannula or anything. The IV in her right AC has infiltrated, so I've been running fluids through her central line. Her blood glucose was 134 at 2100. When they put the central line in, they did x-ray in. She's on 125 milliliters of half normal saline with 20 milliequivalents of potassium right now, running at 125. LPN's about to measure and do an NG2 for her and start tube feeding. When the tube feeding starts, that needs to decrease to 100 milliliters an hour and get x-ray placement for the tube feed. All right, I'm going to contact the doctor right now about the 2 meds, and I would follow up with the NG2 placement just in case the LPN doesn't have any issues. All right, thank you.